Hi, I'm Dr. Andrea Beatles with Eye Associates, and I'd like to talk to you about glaucoma. And glaucoma is a disease that damages the optic nerve, and I have a model of the eye here to show you. The optic nerve is like a cable cord that plugs the back of the eye back into the brain, so everything that the eye sees travels back to the brain to be processed through the optic nerve. And glaucoma, it is a disease that can cause blindness. In fact, it's one of the most common causes of blindness in the United States if it goes untreated. Glaucoma is a disease, well, there's more than one type, but the most common type, primary open-angle glaucoma, is a disease of high eye pressure. So the pressure in the eye becomes too high when it builds up, and it puts pressure back on the optic nerve, and over time it kills the little fibers that make up the optic nerve. And eventually, well, it starts by decreasing or damaging your peripheral vision, and then it eventually leads to tunnel vision and then blindness if it does go untreated. Now, there are some people who are at a greater risk for glaucoma than others, and there's a lot of them, but I'll talk about some of the most common. The first one is anyone greater than age 40. You're at a little bit of an increased risk. Anyone who is known to have high pressure inside the eye, like if your optometrist tells you at your annual eye exam, you are at greater risk as well. And also anyone with a family history of glaucoma. There is definitely a genetic component to it, but just because you have a family member with it doesn't necessarily mean you're going to get it, but it does make you more likely. If you are found to have glaucoma, that's the tricky part about it, is there's no symptoms of it. You don't know that you have it. It needs to be detected by your eye doctor, and they can do that at your annual eye exam. So if you have it, you won't notice your vision becomes blurry. You don't feel the pressure inside your eye. It doesn't hurt. There's no pain. So that's why it's so tricky. Now, the good news is if you do have glaucoma, if you are found to have it, it's very easily treatable. And it's usually very easily managed by eye drops. And what the eye drops do is they lower the pressure inside the eye so that that decreases the damage and the pressure on the optic nerve in the back and prevents that vision loss from continuing. In very advanced cases, you could have laser surgery and eye surgery, but usually it's managed very well by eye drops. So most important thing is make sure you're getting your eyes examined by your eye doctor once a year to make sure that you don't have it, and if you do, that you get proper treatment.